Hi there, this is Dr. Paul and thanks for tuning in to this video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about baby teeth. Now baby teeth or the primary dentition are teeth that come into your mouth between the age of 6 months to 3 years. They're usually your first incisor, your second or lateral incisor, your first molar, your canine, and your second molar. Now, even though these teeth come into your mouth at the age of 6 months to 3 years, they need to stay in your mouth for the next 10 to 11 years. Not all of them, but most of them. And it's really important to keep all your primary teeth in place as healthy as possible because your primary teeth act like space maintainers for your permanent teeth. Now what this basically means is if you have cavities or you have infections of your primary teeth and they need to be either extracted or the spaces are collapsing because of decay, you are basically in such a situation creating shortage of space for your permanent teeth, which will eventually come in, but they will be malaligned and crowded and will need expensive orthodontic treatment to kind of correct the malalignment. So when you think about it, it's really important to keep your baby teeth or primary teeth clean and flossed so that you don't get cavities. Also, if you do get cavities on primary teeth, because the enamel and dentine are so much more thinner than permanent teeth, you're already ahead to getting an infection of the nerve. So in baby teeth or primary teeth, fixing up cavities as soon as you see them is extremely important. Now, if you do end up losing a primary tooth from either some kind of trauma or some kind of infection, you need to always consider a space maintainer. Now, a space maintainer is an apparatus, a dental apparatus that is used to keep the space patent of the tooth that you're missing so that your permanent tooth or teeth can come in and fill that space without being crowded or without malaligning or getting rotated. So again, is every tooth that is lost in the mouth after a primary tooth has fallen away need a space maintainer? No, but it is always very case dependent. Now, if you ever end up losing a primary tooth from trauma, the most important thing to remember is never put that tooth back into the socket. Only permanent teeth once lost from the socket can be put back into the socket, but a primary tooth, if lost through an accident, should never be reimplanted back into the socket. These are the things I wanted to go over, especially baby teeth or primary teeth, just because there's a lot of misconceptions out there wherein, the old school way of thinking is, oh, it's only a baby tooth and, it's no big deal if you end up losing it because a permanent tooth would come in. In theory, yes, this is right, but the problem is once the permanent teeth do come in, they come in malaligned, and then you will have to go through expensive treatments to align all your teeth back into place, either through orthodontics or even some kinds of surgery. Thanks for watching this video, and I hope this has helped some.